Do you still believe that vitamins are always good for your health, especially your heart? The truth is, at least 5 common types of vitamins, if taken the wrong way, can silently harm your cardiovascular system. They can raise blood pressure, cause arrhythmias, and even increase the risk of stroke, especially in people over 60. What's more concerning is that many older adults are still taking at least one of these vitamins every single day. Take a moment, listen to the science-backed advice from a doctor before you take your next vitamin pill. Hello everyone, I'm Dr. Emily Carter, a geriatrician and cardiovascular health specialist at the American Institute of Aging and Heart Health. Today, I'd like to talk with you about a very important but often overlooked issue. Some commonly used vitamins, if taken incorrectly, can silently harm your cardiovascular system, especially after the age of 60. Many people believe that vitamins are harmless, and the more you take, the better. But science tells a different story. Certain fat-soluble vitamins like A, D, and E are not eliminated from the body as easily as water-soluble ones. When accumulated over time, they can raise blood pressure, cause vascular calcification, lead to heart rhythm disorders, or dangerously interact with heart medications you may be taking daily. I've met many older patients who told me they were just taking vitamins to be safe, but ended up hospitalized due to electrolyte imbalances, arrhythmias, or elevated liver enzymes. It all started with taking unnecessary vitamin supplements, or taking them the wrong way, in the wrong doses, for too long. That's why in this video, I'll help you. Identify 5 common vitamins that can be harmful to the heart if not used correctly. Understand when you should take them and when you should stop. And learn 5 golden rules for using vitamins safely after age 60, scientifically grounded, appropriate for the aging body, and tailored to older adults in Europe. Let's begin exploring some truths that may not be as simple as you once thought. Before we dive into the 5 vitamins you need to be cautious with, let's make one thing clear. Vitamins are essential. No doubt about that. For cardiovascular health, certain vitamins like B1, B6, B12, C, and D play important roles, regulating blood pressure, supporting blood vessels, and preventing inflammation and oxidative stress. So why do older adults still need vitamins? After the age of 60, our bodies become less efficient at synthesizing and absorbing vitamins from food due to several reasons. Reduced digestive enzyme activity, a decline in healthy gut microbiota, unbalanced or low-variety diets, medications for chronic conditions like heart disease, diabetes, or gastrointestinal issues that interfere with vitamin absorption. That's why proper supplementation can be very helpful, but why is it so easy to get too much of certain vitamins, and why can that harm the heart? There are 3 main reasons why many older adults in Europe are unintentionally overdosing on vitamins, putting their cardiovascular health at risk. 1. Overuse of supplements, often taking multiple products at once. Many people take 2 to 3 multivitamin or supplement pills daily, unaware that each one may contain overlapping ingredients like vitamin E, D, or A. Over time, this builds up in the body. For example, a vision support supplement plus a general multivitamin plus fish oil. Each might contain 400 IU of vitamin E, adding up to 2 to 3 times the recommended daily amount. 2. Lack of regular medical checkups. Most people don't get routine blood tests to monitor their vitamin levels, so they keep supplementing even when they're not deficient. 3. The mindset that more is better, especially when feeling tired. Feeling fatigued or low in energy? Older adults often reach for vitamins, but fatigue doesn't always mean a vitamin deficiency. It could be due to heart issues, liver problems, or even sleep disturbances. Vitamins are not miracle pills. Used correctly, they support your body well. Used incorrectly, they can become a dangerous burden on your heart, liver, and kidneys. Right after this, I'll walk you through the most commonly misused vitamins, starting with vitamin E. Vitamin E, also known as alpha-tocopherol, is a fat-soluble antioxidant that helps protect cell membranes from damage caused by free radicals. In older adults, these free radicals are believed to contribute to atherosclerosis, cardiac degeneration, and damage to connective tissues. Some studies, such as the Lynxian trial, China, 1993, and the Women's Health Study, 2005, have shown that vitamin E may modestly reduce the risk of heart attacks in certain groups of older women when taken at appropriate doses. The problem is, most older adults today are not deficient in vitamin E, yet are still at risk of overdosing through dietary supplements. These risks have been well documented and specifically warned about in medical literature. 1. Increased risk of internal bleeding, especially when taking anticoagulants. A study from the U.S. National Institutes of Health, NIH, reported that older adults taking more than 400 IU of vitamin E per day over time had a 13 to 21% higher rate of intracranial hemorrhage. Why? Vitamin E inhibits platelet aggregation and interferes with blood clotting, thus increasing the risk of gastrointestinal bleeding or brain hemorrhage, especially when combined with aspirin or warfarin, two medications commonly prescribed to older adults in Europe. 2. Higher risk of heart failure or arrhythmias in people with cardiovascular disease. In the HOPE-2 trial, 2005, involving nearly 10,000 heart patients, the group taking high-dose vitamin E, 400 IU day, had a 13% higher risk of developing heart failure compared to the placebo group. Some participants also experienced irregular heartbeats, palpitations, and mild swelling, edema. 3. Possible increased risk of hemorrhagic stroke with long-term high doses. A meta-analysis published in JAMA, 2004, including data from over 135,000 individuals, found that high-dose vitamin E, 400 IU day, was associated with an increased risk of all-cause mortality and a higher incidence of hemorrhagic stroke in those with pre-existing cardiovascular conditions or high blood pressure. So, should you take vitamin E? If you're already consuming healthy sources of plant-based fats like sunflower oil, almonds, or dark leafy greens, your body is likely getting enough natural vitamin E. There is no need to supplement unless clearly recommended by a medical specialist. Too much vitamin E does more harm than good, especially to your heart. Vitamin A is an essential nutrient that's a fact. It supports healthy vision, maintains skin health, and strengthens the immune system, especially in older adults. But here's something important. The adult body only needs a small daily amount of vitamin A, about 700 to 900 micrograms, depending on gender. Vitamin A is fat-soluble, which means it accumulates easily, and it's difficult to eliminate when taken in excess. Vitamin A is found in animal liver, egg yolks, dairy products, fish oil, and in supplement pills. However, one thing many people overlook is this. Excess vitamin A is one of the most dangerous vitamins for adults over 60, and it poses particular risks to the liver and blood vessels. A report published in the American Journal of Clinical Nutrition, AJCN 2002, found that older adults who supplemented with more than 1,500 micrograms of vitamin A per day had twice the risk of hip fractures due to increased bone mineral loss. And that's not all. The liver is the main storage site for vitamin A and the first organ to be affected by excess intake. Common symptoms include pain or discomfort in the upper right abdomen, fatigue, and elevated liver enzymes. The cardiovascular system is also impacted. A 2005 study from Harvard Medical School reported that high doses of retinol were associated with mild increases in blood pressure and elevated LDL cholesterol. When taken in high doses over time, vitamin A may also cause headaches, visual disturbances, and mild heart rhythm abnormalities. Who is more vulnerable to vitamin A toxicity? Adults over 60 naturally experience age-related decline in liver function. This makes it easier for vitamin A to accumulate in the body compared to younger individuals. The risk is even greater if you're taking eye supplements, multivitamins containing retinol, or cod liver oil capsules without knowing the exact dosage. Remember, if you have a well-balanced diet, your body is likely already getting enough vitamin A naturally. You should only take supplements if clearly advised by your doctor, and ideally, choose beta-carotene from vegetables like carrots, pumpkin, or leafy greens, which is much less toxic than retinol. Don't let your heart and liver suffer the consequences from one seemingly harmless vitamin pill. Vitamin D has become one of the most talked about vitamins in recent years, especially in health advice for people over 60. And it's true, vitamin D plays a crucial role in calcium absorption, maintaining bone density, and preventing osteoporosis and fractures. But there's one common misconception I want to warn you about today. Vitamin D is not something you should keep taking more and more of. Excess vitamin D can silently damage your heart and kidneys, particularly in older adults. Why are older adults more prone to vitamin D overdose? After age 60, the skin's ability to synthesize vitamin D from sunlight gradually declines. To compensate, many people begin taking supplements. But the problem is, many vitamin D products today contain high doses, 2,000 to even 5,000 IU per pill, and many people take them daily without ever checking their blood levels. This leads to a hidden risk of vitamin D toxicity, which can cause vascular calcification, kidney stones, and increased risk of arrhythmias. A study published in JAMA Cardiology, 2021, showed that individuals taking over 4,000 IU day long-term had higher rates of elevated blood calcium and coronary artery calcification. A Cochrane review, 2022, concluded that there is no strong evidence that high-dose vitamin D supplements reduce fracture risk in older adults unless there is a confirmed deficiency. On the contrary, unnecessary supplementation may place extra strain on the heart and kidneys. The U.S. Institute of Medicine, IOM, recommends that the upper safe limit for adults over 60 is 2,000 IU day, unless specifically prescribed by a doctor. Signs and consequences of vitamin D overdose. Common symptoms include fatigue, excessive thirst, mild nausea, elevated calcium levels, leading to soft tissue calcification. Most concerning, calcification of heart valves and arteries, which can lead to aortic valve narrowing and high blood pressure. Older adults with weakened kidney function are especially vulnerable, as their bodies struggle to excrete excess calcium. So what should you do? You should only take vitamin D supplements after a blood test confirms a real deficiency. If supplementation is needed, follow a personalized plan from your doctor and avoid high doses on your own. Remember, vitamin D is a double-edged sword. It protects your bones, but when misused, it can silently harm your heart. Vitamin C, also known as ascorbic acid, has long been seen as a symbol of immune strength. Many of you may even take vitamin C daily, as a routine for years or even decades. But what few people realize is that high-dose vitamin C, when taken over long periods, can be harmful, especially for older adults with heart or kidney issues. Your body only needs a small amount of vitamin C each day. A healthy adult only needs about 75 to 90 milligrams of vitamin C daily, roughly the amount in a single orange or a bowl of strawberries. However, many people take supplements containing 500 milligrams, even 1,000 milligrams every day for years, hoping to boost immunity or prevent cancer. The truth is, the excess vitamin C is usually excreted through the kidneys, but in older adults with reduced kidney function, that excess can accumulate and cause serious side effects. Cardiovascular and kidney risks from excessive vitamin C. A study published in the American Journal of Clinical Nutrition, 2013, found that people who took high doses of vitamin C, 1,000 milligrams per day, had a greater risk of calcium oxalate buildup in the urine, increasing the likelihood of kidney stone formation. Additionally, research from Sweden and the United States has shown that excess vitamin C may actually promote oxidation of LDL cholesterol, a key factor in the development of atherosclerosis. This puts additional strain on the heart, potentially leading to high blood pressure, chest pain, and over time, damage to the coronary arteries. For older adults with pre-existing health conditions, even small effects like these can accumulate into serious problems over time. So, should you take vitamin C supplements? If there's no specific medical indication, you do not need to take vitamin C supplements daily. Instead, prioritize natural food sources like oranges, kiwis, strawberries, and broccoli. These provide sufficient vitamin C along with fiber that supports digestion and gut health. But if you do take vitamin C pills, don't exceed 250 to 500 milligrams per day. Avoid taking it continuously for more than 4 to 6 weeks, and allow breaks so your body can rest and regulate itself. Final reminder: even a vitamin as safe as vitamin C, when taken the wrong way, can silently damage your heart and kidneys. Part 8. Vitamin B6 can cause nerve damage if misused. Vitamin B6, also known as pyridoxine, is a familiar micronutrient often taken by adults over 60 in hopes of improving memory, reducing fatigue, and supporting better sleep. However, here's the concerning truth. Long-term high-dose vitamin B6 supplementation can lead to nerve damage, muscle weakness, numbness in the hands and feet, and something most people overlook. It can also indirectly impact cardiovascular health. Why is vitamin B6 overdose so common? The daily requirement for vitamin B6 in healthy adults is only about 1.5 to 2 milligrams, but many supplements on the market contain 50 to 100 milligrams per tablet, which is 25 to 50 times the recommended amount. What's more dangerous is that many people take these pills every day for months without medical supervision. As a result, neurotoxicity can develop especially in older adults. Nerve damage and its indirect effects on the heart. Too much vitamin B6 can damage the peripheral nerves, leading to loss of sensation in the hands and feet, muscle weakness, difficulty walking or maintaining balance. This impairs physical activity, and staying active is essential for heart health. In addition, some studies have reported that high doses of B6 may disrupt the autonomic nervous system, potentially causing irregular rapid heartbeat or postural hypotension, a sudden drop in blood pressure when standing, especially in those with pre-existing heart disease. Furthermore, excess B6, when not properly balanced with B9, folate, and B12 can raise homocysteine levels, which damages blood vessels and accelerates atherosclerosis, a key risk factor for stroke and heart attack. My advice to patients: only supplement vitamin B6 if you have a clear medical reason. Do not exceed 10 to 25 milligrams per day. And most importantly, focus on natural sources like salmon, bananas, whole grains, and leafy green vegetables. Vitamin B6 can be a great ally for your nervous and cardiovascular systems if used correctly, but when misused, it can silently steal your mobility and weaken your heart over the years. Part 9. So, should you stop taking vitamins altogether? After all the warnings we've discussed, you might be wondering, should I stop taking vitamin supplements completely? The answer is no. Vitamins still play an important role when used correctly, in the right dose, and at the right time. The issue isn't the vitamins themselves, it's how we use them. 1. When are vitamins truly necessary? There are times when your body genuinely needs supplementation, such as when your diet is lacking in key nutrients, during chronic illness, recovery from surgery, or when a doctor has specifically prescribed supplements based on blood test results. What you should not do is take vitamins based on guesswork or unverified health tips from the internet. Taking the wrong vitamin at the wrong time is the real danger. A single vitamin pill may seem harmless, but if used improperly over long periods or without regard to your cardiovascular condition, it can become a burden on your liver, kidneys, blood vessels, and heart. This is especially true after age 60, when the body's ability to eliminate excess substances declines, making it more sensitive to overdose and accumulation. The golden rule: personalized, prescribed, monitored. Let your doctor help you determine which vitamins are truly necessary, what dosage is safe for your condition, how long you should take them, and whether follow-up tests are needed. Don't rush to abandon vitamins, but don't take them lightly either. Using vitamins the right way is one of the most proactive, scientific, and sustainable things you can do to protect your heart and overall health. Part 10: 5 Golden Rules for Safe Vitamin Use After Age 60. After the age of 60, our bodies become more sensitive and finely tuned. Vitamins and minerals, if misused, can negatively impact the heart, liver, kidneys, or nervous system. Here are 5 golden rules I want to share with you to help you use vitamins safely, correctly, and in ways that truly support cardiovascular health. 1. Don't take supplements without testing or medical guidance. According to the European Society of Cardiology, ESC, older adults should avoid taking dietary supplements arbitrarily. Vitamins like A, E, and B6 can be toxic in excess, while their benefits are unclear if you're not actually deficient. Get regular blood tests to know whether your body really needs supplementation. 2. Prioritize fresh food and the Mediterranean diet. Studies have shown that vitamins from natural sources, such as fruits, vegetables, fatty fish, nuts, and olive oil, are better absorbed and far less likely to lead to overdose compared to synthetic pills. For example, a meal of salmon, greens, and fresh fruit can provide sufficient B6, C, D, and E without the risks of megadosing. The Mediterranean diet has been proven to reduce cardiovascular risk by up to 30% in older adults. Pre-Dimed Trial, 2013. 3. Use vitamins in the right dose. Avoid megadoses. Some supplements today contain doses 10 to 50 times higher than recommended daily values. This doesn't make you stronger, it only increases the burden on your liver, kidneys, and blood vessels. Read the label carefully. If you see vitamin A, 2500 IU, or B6, 10 mg, consult your doctor before using it long-term. 4. Don't take supplements for many months without follow-up. Even when initially prescribed, any vitamin taken for 3 to 6 months should be reassessed regularly. Fat-soluble vitamins like A, D, and E can accumulate in body fat and cause harm over time. Ask your doctor, how long should I take this? Should I get tested again? 5. Always consider drug vitamin interactions, especially with heart, liver, or diabetes medications. Some vitamins can interfere with blood thinners, heart medications, or blood pressure drugs. For instance, high-dose vitamin E can increase bleeding risk if combined with aspirin or warfarin. Tell your doctor about every supplement you're taking, including over-the-counter and natural products. Final advice: vitamins aren't the enemy, in fact. They're essential to good health, but they should be treated like medicine, with clear purpose, proper dosage, and regular monitoring. That's the smartest and safest way to protect your heart every single day. Dear viewers, the vitamin pills we often assume to be harmless can sometimes act as a double-edged sword, especially after the age of 60, when the heart has already worked tirelessly for decades. Vitamins A, E, D, B6, and C, when taken in the wrong doses or for too long without proper guidance, can place silent pressure on your blood vessels, liver, kidneys, and nervous system. All of these are factors that quietly weaken the heart, often without us even noticing. But here's the good news. You can protect your heart simply by making smarter everyday choices. Eat a natural and diverse diet. Avoid taking supplements without clear reason, and always consult your doctor before adding any vitamin to your routine. Let me say it one more time. The right vitamin for the right person at the right time is truly beneficial. But even a healthy-sounding supplement, when unnecessary, can quietly do harm. If you found this video helpful, please share it with your loved ones and peers, so we can all stay healthy, joyful, and help our hearts stay strong as the years go by. And don't forget to subscribe to this channel. Each week, we bring you clear, science-based medical advice tailored especially for those over 60. I'm Dr. Emily Carter. Thank you so much for watching. Wishing you strength, happiness, and a healthy heart every day.